Um, Perfect. Thanks, Jane. So go ahead, Karen.
All right, let me get our slides up here. Can you guys see that?
Yep.
Perfect. So today we're going to talk about implementation outcomes, and I wanted to just level set us and kind of give you the plan for the rest of the year, and just to kind of orient you where we're at in kind of what I think the planning group sees as kind of the big fundamental buckets of implementation science. It's really kind of comprised of these 4 parts: theories, models, and frameworks, or TMF for those in the lingo, implementation designs, implementation outcomes, and implementation strategies. And there's lots of details in each of those, and can dive really deep, and other pieces that have kind of come along, but those are kind of the fundamental structures. And so what we wanted to do was, because we've talked about some of these other elements before, is to kind of pick up, we felt the one place we have, or a starting place for us where we haven't spent much time up to now, is implementation outcomes. So we're going to talk about that today. And then our agenda for the year will be to do a mix of works in progress and different topics. So Becca, do you want me to go through this, or do you want to go through this? You're the mastermind. Okay. Well, so the plan is that for about every 2 sessions or every other session, to do a works in progress, to deep dive in, ideally, into the topics that we're talking about. So today we're going to do outcomes, and then we're hoping that next week we will have, or next month, we will have someone who might want to do, or a couple of folks who might want to do works in progress around their work with implementation outcomes. We're going to do in December a writing successful implementation science grants panel discussion. And then in January, we'll move on to implementation strategies, and then a works in progress on strategies. And then in March, we'll do designs and kind of go back into that again, and then do works in progress. And then we'll end the year with grant writing or a networking opportunity. And we've designed it this year based on your feedback. It's been really great that people, every year at the end, we get your ideas on what we should do for the coming year, and having more opportunities for works in progress has come up a lot. So we wanted to really build that in this year. Now, Becca, what do you want to add? What have I left out or forgotten to emphasize?
I just put in the chat that if people are interested in presenting a works in progress, please let us know, send us an email. A few people volunteered at the end of your day, but we will have room for others. So please let us know.
Perfect. All right. Any questions on that, or comments, worries, enthusiasm? All right. So this is the plan. And Becca is going to tell us about this slide.
Absolutely. Absolutely, I am. So also putting in the chat here a link. So one of the other things we really wanted to make sure that we're doing in this work group in the next year is making things much more interactive. And so this is a snapshot of what Slido looks like. And we'd really like folks to add any of their burning questions on this particular topic using the link that's in the chat. What this allows us to do is some people submitted questions like me. When I did this earlier, it was just me. Now I think there's 6 or 7 questions in there ahead of time, but there might be other pressing burning questions that come up during Karen's lecture today. And if you want to just pop them in the chat, in addition to raising your hand during the lecture, we can do a mix of engagement. We really want to get more voices involved. And what Slido allows you to do is not just to add your question, but with the little thumbs up button on the right there, you can upvote a question if it's one that really resonates with you and you'd love to hear the answer to it. So we're answering the questions that are of most interest to the group. And if you feel comfortable putting your name, please put your name, because that's how we can get more voices in the room. A lot of them are anonymous right now, but if you want to put your name and your question that might come up during the lecture, please do so. So I'll pass it back to you, Karen.
Great. Becca, when do people upvote? They can look at the list now and upvote them. And then as questions come in along the way, you can vote for them. Very good. And I'm just going to say at the outset, I don't want to just listen to myself talk for the next hour. So be alert. I may call on some of you to ask you your thoughts on some of the questions. I am not the expert in this area. I'm someone who works in this space, but there are a lot of other people on this call who do. So we really want to kind of try to emulate a little bit more what it would be like if we were all sitting around a conference table, like we were in the old days before COVID. So really, really do try to help us engage in this. Okay, so with that, maybe if my slides are going to cooperate, there we go. Okay, so I'm going to just jump right into the topic of the day. And I would encourage you, if you have any comments or questions along the way, please jump in. I'm actually minimizing my screen so I can see my slides. So if you have a question, you put your hand up. I may not see it, so Becca, or just shout out and I will stop and take your question. So let's make sure we're interacting along the way. But I wanted to put implementation outcomes in a little bit of a context of what we do in really all of our research designs, but especially in our implementation research designs. So if you think about it, we have sort of what it is that we do, which are interventions. And our interventions usually measure patient outcomes or some kind of an outcome. And often in our interventions, we may be looking at patient or other kinds of outcomes, clinical status, symptoms, function, satisfaction. And the how are really our implementation strategies. And the implementation outcomes are the manifestation of that activity, right? So how we put the interventions in place are the implementation strategies. And for those things, we're looking at feasibility, fidelity, penetration, acceptability, sustainability, uptake, and costs. Those are from the Proctor model. This is sort of a classic implementation outcomes model that I think, the vast majority of people in this space refer to this and use these in your grants. When we get a little bit further down, I'm going to be bold enough to suggest that equity is also an implementation outcome that we should routinely be looking at. It was not included in the Proctor model, but I think based on Arnola's writing, we can safely say that that should be included now. So that's kind of situating where we're at, is in that middle part. And then there are also service outcomes, and that kind of sits in between the implementation and the patient outcomes. But we're going to be talking about implementation today. Is there a question? Okay. So why do we need implementation outcomes in the first place? Why do we need these that are distinct from client outcomes? Well, there are a couple of reasons. A program may not be adopted, and so we may not get client outcomes. We need to understand what's going on there. So our implementation outcomes help us understand what happens on the client end. So we may have a case where a program is not just taken up. You could have an effective intervention that's poorly implemented. And so understanding what happened in the implementation is going to be critical in helping you understand why you didn't get much of an impact. And I think some good examples of this, if you think about any kind of a vaccine implementation, there are all these different places where you could basically have things go wrong, where implementation just doesn't happen well, even though you have an effective intervention such as a vaccine. So trying to understand all of the steps along the way and the implementation challenges and outcomes on those steps is really critically important to understanding your overall outcomes. You could also have an ineffective treatment that's successfully implemented, and that's something that you want to understand. And I thought this Time article was really interesting about how an online pharmacy sold millions and millions of dollars worth of ineffective or dubious COVID drugs. And you could look at this two ways. One is that the drugs are ineffective, but used a very effective implementation mechanism, which is the online pharmacy. Or you could say the online pharmacy was an evidence-based intervention. We know that these work pretty well, getting drugs to people, increasing access, but the online pharmacy as an evidence-based intervention did not work as intended. So it's a really interesting thing to think about the full range of different outcomes that you might have. So when we have a failure in an intervention, for example, we have to ask ourselves, was it about the setting? Was it about the way the implementation of the intervention? Was it deployed incorrectly? was an implementation failure, an intervention failure, what happened? And so that's why we need separate implementation outcomes. So I'm going to walk through these, and I'm going to go a little bit quick at the risk of, if it's going too fast, let me know, but I really don't want to bore everybody by spending a ton of time on these. I'd rather spend time talking them through. So I'm just going to walk through and make sure that everybody is on the same page about the definitions. So the first implementation outcome is acceptability, and that is the perception that a given intervention is agreeable, palatable, or satisfactory. There are lots of different ways that you can measure this. This can change with experience. You would hope that acceptability increases over time with people's familiarity and the effectiveness of the implementation that might work. But it could be reduced based on the idea that over time, there are other alternatives that are introduced, right? So you may have one set of implementation strategies and find out later that there's something else that's better along the way. So it's important to remember that implementation context changes over time, and therefore you might see these change over time. And I think that's a really important thing about implementation outcomes is we don't expect them to be static. So you might measure them from the perspective of the patient or of the provider or of a community, other stakeholders, a whole range of folks. That's acceptability. Appropriateness is the fit of the evidence-based intervention for a specific setting or group or problem. And I'm going to highlight some of the places where there are validated measures that are available. So there is the intervention appropriateness measure that came out of a group out of University of Washington with Brian Weiner in their group. And I'm going to actually go into a little bit more about the measures in just a minute. So appropriateness is the fit for the specific setting or problem. And then feasibility is the extent to which the evidence-based intervention can be used in the setting or with the population. So a program can be appropriate for a setting that it may fit with the mission, for example, but not be feasible due to resource requirements, for example. And there is a measure for this called the feasibility of intervention measure. So here are the scales that were put together by Weiner's group, the acceptability measure AIM and the IAM, which is the intervention appropriateness. And one of the things I really like about this is they've demonstrated the psychometrics of this and they're pithy. So you have sort of a 4-item measure here. The intervention meets my approval. It's appealing. I like it. I welcome it. For acceptability and appropriateness, does this fit? Is it suitable? Is it applicable? And a good match for our setting. So again, focus more around the fit than the appeal. So those are measures, and you see these used so frequently now in implementation grants. They're just used very, very frequently. This is, I think, I would argue this has kind of become a standard set of measures. I did want to just highlight this note at the top where they basically say, please check and report the psychometric properties with each use or modification. And this has been such a failing of our field. You know, we recreate our measures all the time. We've had some groups that have really tried to get out ahead and develop validated measures. And then we forget that these things change, that the validity might be different in different settings. So it's just a really good reminder to be thinking about psychometrics of your measures and really trying to make sure that they work well in your setting or population. Okay, and this is the feasibility of intervention measure, which is the intervention seems implementable, possible, doable, easy to use. So one of the other things I wanted to highlight about this set of measures is how pragmatic they are. And again, in implementation, we're often trying to think about how we measure things succinctly, with some amount of rigor, which can be sometimes mutually exclusive. So we want to take advantage of where things are pragmatic and they are validated. They have a really excellent readability level. They don't require any specialized training. They are working on trying to get cutoff scores for interpretation, but generally the higher is more of the property. You can create scales by for each measure by averaging the responses. They're free and they're fast. So really good measures to use, probably explains why they're used a lot. But these are really good properties if you're interested in evaluating or developing new measures for implementation outcomes. These are really good things to keep in mind. Okay, so acceptability, appropriateness, and feasibility together are predictors of adoption or uptake. And that is really your intention or your action to employ a particular intervention. And you can measure adoption from the perspective of a provider or from an organization. I think in most of these, you can look at them from multiple perspectives. Okay, let me just stop for a second and ask if there are any questions on these measures so far.
I have a quick question.
Yeah.
Hi. So on a previous study I worked on, we're a bit more measuring usability than acceptability, appropriateness, feasibility. So this question may be a little bit out of context, but we use similar evidence-based measures kind of on a Likert scale to evaluate the usability of our tool. And I really found that the measure alone was almost a little bit incomplete without the context, because when people would fill them out, they'd always be like, well, I'm going to put a 3, but, and then tell me the story, right, of like why they were putting their answer. And it was really great, important context, but it didn't quite get captured in their 3, if that makes sense. So how do you pair these things with other types of questions or measures that give more of a comprehensive picture of like the actual perception of your intervention? Does that make sense?
It does make sense. It's a great question. And I'm going to tell you what I think, and then I'm going to open it up to others, because I think this is, again, this is both an art and a science. And so we're different ways to do these things. I think there's real value in all of these measures to have qualitative measures as well. And I think that is a really, really important reminder that we can try to, objectify these outcomes. But I think that it's really important to really understand people's experience. And the more you can not only get qualitative data, but really along the way, try to be embedded, really understand what people's experiences are, I think the more you learn about these measures as outcomes. I do think that there's a real opportunity to think about developing measures that do have a little bit more contextualization. And that may be where, as a field, we grow and really try to develop what happens when you contextualize these things. How much context do you have to give? And I think understanding what people are experiencing along the way will help you develop the measures as outcomes better, and understand where that balance is. But let me open that and see what other folks think. Is that good advice? Other ideas? What do you think? Steve's giving a thumbs up. There are a lot of expert implementation scientists on this call. You don't want me to call you out, and I will if you don't speak up.
I had a different question, really, which was about the what these questions and the focus here seems more on clinical interventions when I think of the policy interventions that I'm interested in. A lot of the feasibility issues don't revolve around people thinking, oh yeah, we could do that.
Yeah, I think that's a really excellent point, Stephen. I for one, would argue that we have not done a good job really developing policy implementation outcome measures. I don't even know that we've gotten to a point where we agree as a field on policy implementation outcomes. Forget about measuring them. So there are a lot of folks who I think are interested in starting to do more work in that area. Heather Bullock, I think, has done, she's, I believe, at McMaster now, has done some nice work in trying to start to develop out some frameworks in implementation language and bringing an implementation science lens to policy. But I think that's a huge area of need. Some of these examples are a little bit more clinical just from where I'm lifting them. I think they could be probably more easily applied to community focused work or public health work than to policy, I think would be fair to say. Other thoughts?
I'm just going to highlight that Natalie just put a good quantitative measures of health policy implementation outcomes in the chat. So that could be something to look at.
That's fantastic. Yes. So thank you very much, Natalie, for doing that. So that Peg Allen paper is a great review. What she goes through with her team and did a systematic review to look at a range of, how we generally think about implementation outcomes applied to policy. And I'll just give you the punchline is that, very few things are measured in a systematic way. Very few measures necessarily mapped to the things that they said they were trying to measure. There were no validated measures. It was a very sad story for our field. So it's a really great start because it tells us what the baseline is in the policy implementation space, and just only up. But that was, I think, a really great catch, Natalie, to mention that. Yeah, Don. Nice to see you.
You may be going to discuss this a little bit more, but I'm intrigued by the adoption of outcome as the intention or action to employ an intervention. Very often in the improvement work that I've been involved with Institute for Healthcare Improvement, there's this reflex asking the participant if they intend to take what they learn and actually adopt it.
Yeah.
And I find that to be not helpful. Because very often they say they intend and then they have the reality of their context and circumstances and time and do nothing. So there's a huge difference between intention versus action. I wonder if you could comment a little bit about that.
Yeah, I think you're absolutely right. And as a behavioral scientist by training, there's this phrase we like to say is the best predictor of future behaviors, past behavior. Intentions are important. I think that what's important is action in this space. So I would agree with you that I think you're much better off at measuring things as action as opposed to intentions. I suppose there are times when you're maybe doing a initial pilot that you really can't go through, or pre-implementation work where you can't really test the actual adoption, where that might be a proxy. But I think that's really the point, is to go to actual adoption.
I tell you, your program's in trouble if nobody intends to do anything when they go home.
Yeah.
That's a bad sign.
Yeah, chances are you're not going to get a negative there. So yeah, exactly. Okay, that's great. Thank you all very much for the engagement. So implementation cost is another one of the outcomes. And this is the cost impact of the implementation activities and the effort. This was an area that about, 4 years ago was like nowhere. And NCI and a bunch of others have gotten together and done like an enormous amount of work in this space. So suddenly we have special issues. We have lots of emphasis in this. Doug Levy and our team has been really involved in this space. And this is the URL for a compendium of papers that has now been developed and published in the implementation cost space. So there's a lot happening here. I know for myself, as someone who does a lot of work in community health centers, this seems so important to me, because when I go into a health center and I say, hey, can you, we really want to do this, implement this thing and in this way, and figure out together how we're going to implement this, there are really big cost differences in what I'm asking them to do. So some of these implementation activities may be very inexpensive because they are built into electronic record. They're text messaging systems that automatically get deployed. They're really not costing in the implementation part a lot, but there may be back-end costs in terms of now you have a lot more people coming in, need more staff. How we really think about that and what we're asking healthcare leaders and community partners to do, and the cost of that is really important. So that's an area where there's a lot happening. I'm not going to go into the details of this very much, but be aware of it. And I think there's going to be, continue to be an area of emphasis and growth. Penetration is the integration of a practice into a setting and its various subsystems, like providers or particular units. Or if you're looking at a large health center, they may have different subsites. So how well is that practice integrated across all of the subsites? I'm curious to see, how have people seen penetration measured? Do you see this measured, and in what ways have you seen it? Anybody want to bite at that? So you see it measured like by the number of eligible people who might use an EBI divided by the total number of eligible people, maybe the number of providers who were trained by the number of providers who deliver it. Actually the other way. And then, so there's lots of different, subcomponents that you might think about penetration. You might think about penetration to different population groups. So do men receive it more than women, do older folks or younger folks? And so I think the key there is to think from back to your sort of theoretical framework that you might be working with and what your primary aims are. What are the most meaningful measures of penetration for your work? Yeah, Steve.
Yeah, how do you see penetration relative to reach?
That was my next question, Steve. Great work. We did not plan this. So that I was going to ask if penetration reminds you of any other construct within any other IS framework. And the answer is reach and re-aim. So that it really is that I think of them as one and the same. It really is reach.
I think that's an easier, in terms of asking, the silence that you got on penetration might be because I think most of us think in terms of reach.
Yep.
So you might, and I do think that is such an easy, it's not easy. It's a concrete metric. It's just brilliant that the whole re-aim framework is actually can be reduced into denominators and numerators and things that can be measured in general,
Yeah.
But I think reach is one of those. But I don't know whether I've thought about reach as you just described around also thinking about subsets. I think it's a really interesting question. It's not just, is the denominator the big denominator, or are there sub-denominators for which you really want more precision? And that's really interesting, and that gets into the equity issue, obviously.
Yeah, I really like that point, Steve. I feel like when I review papers and review grants, that people are using these things in a very sort of cookie cutter, one size fits all way. And so I'm really interested in this idea of, first of all, it's like sort of what's practical, but it's also what is the achievable, what are you trying to achieve and how does that all map to that? So I think in all of these implementation outcomes, mapping that forward is critically important. And sometimes we lose sight of that and they don't necessarily line up. Yeah, Hannah.
So along that same line, how does penetration relate to sustainability? Like, what does it mean for somebody to integrate a practice into their setting, but to only do it for a second or while you're there?
See, you guys are so great. This is like perfect. I guess I didn't have to send the slides out in advance because we've got this all in order. So penetration, I think of, and again, I'd love others' thoughts on this, especially if you disagree with me. Penetration is when I'm doing it, who is it reaching? Who is it getting done by? And sustainability, I think of more as, is this thing, does it have a life? Does it get institutionalized by whatever the setting is? So a key question is really, how do penetration and usability and sustainability relate? So Hannah, do you have thoughts on that? How do you see them relating?
I think I'm just personally more interested in sustainability.
Yeah.
But I can understand too the value of taking a look first at penetration and saying, okay, what were the things that made this happen, right? Like why and how, did this intervention end up being used in this setting? And then if it wasn't sustainable, why not? Like I can see how they
kind of lockstep, like one to the next kind of thing. Yeah.
Yeah.
Yep. I think that's right. I also think that the more penetration you have, the higher your chances are of sustainability, because the more you get this into the subunits of the organization, the more likely they are to be, you've got more chances that somebody's going to pick it up and continue to keep it going, right? So maybe it's just a sort of an odds thing, but I think the higher your penetration, the more likely you are to have sustainability.
Yeah.
Does that make sense?
Yeah, it does. Thank you.
Yeah.
I definitely think,
Yeah.
oh, sorry.
Alana, no, please go ahead. Please go ahead.
I definitely think there are situations too, like maybe more commonly than we immediately would suspect, where an institution will adopt some program or whatever, but providers or patients or whoever the group of interest is are just not interested really in participating in that program. So I think it definitely, like, they're definitely not necessarily the same thing.
Right. Yep, exactly. That looked like you went off mute. Did you have a comment?
Oh, I did, yeah. So when I come from a slightly different background, right, from IHI with its own vocabulary, so I want to be careful not to use my jargon. But when I think about this penetration and sustainability issue, it's reliable implementation of whatever it is over X time by whom. So very often what my colleagues will do is they'll look at number of clicks and downloads and all that kind of stuff, which to me is a very weak measure. It's a dissemination measure, but not really an implementation measure. So I guess I could add reliable implementation with fidelity over time by X people over X time is the way I think about it.
That's really helpful. Thank you. Kelly.
So this all is, it's really interesting, especially when you write a grant and you're trying, which we just did recently on studying fidelity, sustainment, and adaptation. And you really get down to trying to operationalize and measure. And sustainability, I learned through that process, is actually something different than sustainment. So you can assess the sustainability, the perceived sustainability. Will this last? Earlier, and you probably want to earlier than you actually will study sustainment over a
Yes.
long term. And then when you're studying sustainment, you also want to be careful not to conflate that with fidelity. So how do you tease out some of the things Don was saying sounded like maybe his version would have fidelity wrapped in to sustainment. It's like quality to delivery by whom. But really, when you get down to measuring these distinct constructs, it's really interesting to think about, well, how do you, and we were working with some colleagues who have some expertise in sustainment research, really pressed us to think about what's the most basic definition of sustainment of this EB, this evidence-based intervention that you can come up with that is distinct enough from fidelity, because we are also separately measuring fidelity and we're measuring adaptation to the thing too. So it was a long exercise, probably lasting at least a month of going back and forth or more and really trying to tease out, like, what do you say? What do you say long-term sustainment is? And this is in the context of a multi-component behavioral intervention, which has a little maybe more complexities than some other EBIs in healthcare that may be more simple, and you might not have a lot of fidelity, commodes for fidelity. So it's really interesting to think about the difference between sustainability,
Yeah.
sustainment, and then sustainment and fidelity, and then where adaptation fits in.
So Kelly, how did you guys settle on measuring sustainability and sustainment?
Well, we didn't measure sustainability because this is a 10-year follow-up.
Oh,
So we felt
okay.
like
You're going to be able to measure sustainment.
it's not sustainable. It was long gone. So we're measuring sustainment, and it's just a very, it really was hard to let it go. Like, this is basically, you have a person dedicated to delivering this program, and they're called this, they were called, in our case, this is the InShape program. So they're called this health mentor. So you have a person dedicated, and they're seeing at least one person in there, because then you get into these issues of, well, how many people do they need to see for you to be calling it a program? And so we got it a very basic definition that Doug Luke and his group use around, basically this thing needs to be in place. Somebody needs to be delivering core, and we distilled it down to some core elements that were related to, but separately from evaluating the fidelity of it, like the quality of the measurement, just making sure these core elements were being delivered by at least one person dedicated to seeing at least one client. And then the fidelity measurement was different.
That's really helpful. And, it's a really good reminder, because I think when Anola wrote these outcomes in 2009, sustainment wasn't really anywhere. And so this definition from her original work really does kind of mush together sustainment and sort of aspiration and reality. So that, I think that is an area, it's a really excellent point that's really come along more, although I don't know that many people are doing it. I think a lot of people are talking about sustainment, but you guys, I think, are at the vanguard of trying to figure out how to do it and measure it. So that's great. So then I mentioned to you earlier that the last, I think this would be like the 9th implementation outcome, which I'm just going to be audacious and put out there. I think equity and the extent to which an evidence-based intervention leads to equitable implementation and treatment outcomes should be an implementation outcome. You can define that in lots of ways. There are lots of different things to consider, but I think in this day and age, and especially in implementation science, there's been a lot of discussion writing now about the importance of equity and really trying to take this more seriously, because if we don't, we're just going to perpetuate inequities and maybe create new ones. So we should be paying attention to this. So this is another one that I think in grants, we're probably already starting to see some of this and should be taken quite seriously. Okay, then the big one, last but not least, Fidelity. And I'm going to dive into this just a little bit more because it's such a common outcome that I'm seeing in K awards. And I know we have a lot of folks that have been coming that are rating Ks. And so Fidelity is the degree to which an intervention is implemented as prescribed or intended. There's this whole thing I'm going to get into in a minute, I think, about form and function. So the form is, there we go. The form is kind of the purpose, the intended effects linked to needs, and the function would be described as the activity, the format, and operationalization of the form. Does anybody have any examples that they might like to share with us about sort of the form versus function idea?
Well, Kelly and I talked a lot about this in the proposal you just heard about, so you could have an intervention where the function is to promote, let's say, weight loss, for example, or fitness or something like that. That's a goal, or to specifically engage in activating people to engage in exercise and the like. The form can come in a number of different ways, and where it gets difficult with Fidelity is that if the intervention is really targeted to really achieve, for example, weight loss, just any physical activity isn't going to do that. Just going for a walk or doing things, you have to have a certain degree of intensity, and so the form matters in the sense that it needs to be linked to the effectiveness, but the form can be altered in terms of the way that it's delivered. For example, telehealth or in person. So it's not, as Kelly and I talked about this dichotomy, originally I was really excited about the form versus function. The more you start to peel away at it, it's like, it's not as simple, as there's one that the form is really something that is more generalizable or less well defined, and it's all about the function. That these things really are more tightly linked, perhaps. But I think in the general sort of way, the function is as you say, the thing that it's supposed to get at, and the form is how it's packaged. But Kelly, you might want to say more about this. Yeah.
Sorry, this gets us so excited. It's sustainment, fidelity, form, function. I think that if you have, sometimes when it comes down to it, seems like if you have evidence that certain components of your intervention relate to an outcome, like you've done some way of dismantling, if it's multi-component, and you can say, even though they kind of look like forms, but you're pretty sure they need to be there because they're related to your outcome, to me, then they should be there. I think where this comes from, this form versus function, as I'm trying to understand it, is like, but we have a lot of multi-component, especially behavioral interventions, where it's just so many things are in it, and people get really tied up in fidelity. Like all of these 10 things need to happen every time with every person for this thing to be effective. And it's the idea of using form versus function is like, well, let's see if we can break apart, like what part of this are things that are activities. Like, yeah, they're happening, but you could replace them with other activities and still have the same outcome that you're trying to achieve. The thing would still be effective. And I think to me, where I would be most confident in a form versus function approach is if I really knew, like I did some exploratory analysis, or I knew that there were certain components that really didn't have much of an effect, and I could I could call those forms and you could replace those with other forms, but I was pretty confident I had a few components that were like, no, they're, these are really important. They have a big effect on my outcome or something. Because I think without the data, it's can get a little mushy.
A little squishy. Yeah. I do think that some of this came about because of our lack of pragmatism in developing our interventions. I think, we wind up with so many different things we're asking people to do. And so I think the more pragmatic we are, maybe to some extent, it helps that a little bit. So there are lots of different ways to measure fidelity, adherence to a protocol, a dose or amount of a program delivered. Some will say quality of program delivered, the exposure that a group has to the intervention, and then participant involvement. So there are lots of different ways to think about this. And again, I think, kind of going back to what it is you're trying to accomplish and kind of diving into that really makes a lot of sense. Examples here. Yeah, this is a slide that Brian Mittman had in one of his talks I thought was really helpful, and just talking about how the other thing on the forms is that they can have multiple functions. And so he talks about how you could, when you do drug detailing, it conveys information, it educates, and it also conveys professional norms. Audit and feedback conveys information. So here's what we do in our performance and practice patterns and professional norms. And it also sets expectations about, here's where you are relative to where we want you to be. So leadership expectations get conveyed in that as well. Quality improvement collaborative teams provide broad input and expertise and enhance acceptability of findings and recommendations. So it does get really complicated, but I think there's a fairly important need to try to tease some of this out for yourself, because it will help you get better at what you're measuring and be a little more precise. Any other questions or comments on this? This is I see people in grants saying, our main outcome is fidelity and we're going to measure fidelity protocol. It's like, oh yeah, right. What does that mean? So the specificity becomes really important here. Okay. So let me minimize this so I can see this slide. So this is an example of a study that was done by a group, the Swedish study, that were looking at doing an intervention to increase the use of guidelines for prevention of mental unwellness at the workplace. And so I just thought this was kind of an interesting example of how they are going to explore multiple implementation mechanisms through which a single implementation strategy or a sort of multifaceted implementation strategy might operate to affect the implementation outcomes. And that outcome is really fidelity to the guideline that they have for this prevention of mental unwellness in schools. So the guideline gives recommendations about how workplaces can prevent mental ill health, as they define it, among their personnel by managing social and organizational risk factors in the workplace. So this just kind of shows you what the intervention is, what the implementation strategies are, their hypothesized mediators, the fidelity to the guideline being the implementation outcome, and then health outcomes. What I thought was really interesting was how they were measuring fidelity, and their rationale for how they were thinking about that as an implementation outcome was that if schools adhere to the guideline recommendations about these social and organizational things they should be doing, then school personnel will be exposed to those activities. So they're doing a couple things. They're using a checklist and a web survey at 3 points in time. And so for each of the recommendations in the guideline, they're going to have school management indicate their agreement with whether or not that recommendation is in place or utilized in their school. And then they have separately, they have a web survey with a number of statements to ask about whether or not these things were done. So it's kind of to the management level and then the people in the school level that are completing the web survey. So I thought that was quite interesting. What do you guys think about that? Oh, actually, there's one more slide here. And then fidelity to the implementation strategies were assessed by the research team via a checklist to note whether they were implemented in accordance to the study protocol and a research log. So you have these sort of two ways in which they were looking at fidelity, the fidelity to the guidelines, and then the fidelity to the implementation strategies. So thoughts or feedback on those, the way they operationalize fidelity?
I like how we're seeing fidelity to the implementation strategies and not just the intervention. I feel like that isn't happening very much. And I kind of like, why don't we? Why is that not standard? So that's interesting to me.
Yeah. Kelly.
Well, it's interesting that I know at least in mental health, there's often reviewers want to see objective assessments of, so these were self-report, even though they're two, sounds like different perspectives. They're not, they're self-reporting whether something happened or whether, whether there was a policy. And it's like, I wonder, because that is really hard to do, the observational part of fidelity. And I've been wondering in implementation sciences, if the field is letting go of some of the, the desire to have observational, because it's not pragmatic in a lot of settings to do that. And if self-report is becoming the standard, or so I find that interesting about this article. That it's
Don.
I think it's great. First of all, I love the hypothesized mediators. I hadn't actually seen that before. And where I was struggling, when I think about the talk I gave earlier today, I know for a fact, based on behavioral science, I think, that will have minimal impact on anybody's behavior. Yet, if you use what I like a lot, the Kirkpatrick framework, the 4 stages, I'm sure they had a good time. I'm sure they learned something. But I don't think they went and adopted anything. Maybe a couple will change their behavior, but I sort of doubt it. So by giving the predicted output, and I love that term as well, of an activity or the hypothesized mediator by which it will change behavior, I think that's a solution to the problem I always have when I see activities and then I see implementation outcomes come next. So I love that slide. Regarding the study, I think that this self-perceived adoption is important to know as part of process evaluation, because if that doesn't match the actual review of the checklists, then that's a real issue for what people think they got about the dose and the action based on the dose and what actually happened. And figuring out why that difference exists is the whole point, right? Because you don't want to repeat that again and have people say, kumbaya, I got it, we're all together. But yet nothing changed.
Yeah, thank you. We'll go to Natish and then Hannah.
Thanks, Karen. What strikes me as challenging about many of these outcome measures is the fact that we use words, they're plain English language words, which can be interpreted multiple different ways, which I think is frustrating for, even for those of us that have now been thinking about this for quite some time. So for example, I wouldn't call, personally, the first checklist fidelity. I might call that adoption, but and I think ultimately the point that is important to remember, at least in my mind, is I don't think it makes a difference what you call it. Yes, someone is looking for, what framework did you use? These are the 7 things that I'm measuring. But ultimately, you can take those same words and then define them however you want for the context that you want. So I was struck on the prior slide that the only implementation outcome they measured was fidelity. And when in fact, I think what seems like what they're doing is they'd be interested in much more than just that. But it's because they've defined fidelity so broadly and in effectively 3 different ways that we sort of lead to their conclusion, which is perfectly fine as long as we know what they did or are doing.
Thank you. Yeah, that's a really excellent point. It is super broad. Hannah. Oh, you're on mute, Hannah.
Thank you so much. I'll be quick. I think I have a lot of questions about the outcome as well, and this like self-report nature of the outcome, particularly when it comes to perhaps the power balance between the research team and the stakeholders whom they're training. I feel like sometimes we go into these places, and especially if they're like community-based orgs, and are kind of like, oh, we're the big smart researchers coming in and suggesting these things. And I'd be really curious to talk or to understand more the potential bias in the self-report of like, oh, these are the things we're supposed to be doing. I want to make sure that I check off that we're doing these things, and how the social context and perceived power of the different parties would affect the way that people would accurately or not accurately respond to these. Just an agree not doesn't give, I don't know. I wonder if that gives enough room to explain like, oh, you know, this is why or why not. But the power
Yeah.
balance to me struck me as something that could bias it.
And it sounds like you're really talking about social desirability, that the sort of, they're going to want to please the investigators, and so they may respond. They did, so you said yes, and if you said yeah, or yes or no, if you said yes, then you have to write out like what it was that was done and how it was performed. And attach whatever the document was. So I think they went to the guidelines and said, the guideline says that you should update your work environment policies. Did you do that? And if I say yes, and I have to show you that I did that. So they've tried to tie it. This is, so surfacey what I'm presenting here, to the details of the guidelines. But I would worry a lot about people just kind of blowing off the detail, because, I'm happy to tell you yes, but now I got to sit down and write a diatribe about this and pull out the policy and attach it for you. It's a lot of work if there's, 12 different guidelines. So I think that might affect the measurement as well. So I am totally blowing our opportunity to do the Slido thing, because I'm getting such great participation from you guys. This is so great. So, but anyway, let me kind of breeze through here. I did want to just point out that there was this review. It's a little bit dated now. It was 2015 by Kara Lewis and team, also out of the University of Washington. And they identified across implementation outcomes, they identified a lot of different constructs, and basically, again, kind of what we were saying about in the policy space, very little evidence for psychometric strength, very little assessed, really no information on responsiveness to the item's predictive validity. So this is an area where we as implementation scientists really need to work. Just looking a little bit at the literature about what is measured, this comes up a lot in questions when we consult with grant writers, and they're like, what do I have to measure? What should I measure? You should measure things that are relevant and make sense for the work that you're doing. But most often people measure fidelity. I think least often, sustainability, and I think even more least often would be sustainment. Kelly, thanks for your clarification on that. And then costs. As some research have suggested, the most often mismeasured is penetration, where people will say, oh, we're looking at penetration by looking at providers' attitudes, and that is not at all what penetration is. So the clarity and the precision on these things are important. These are just some tidbits about things that we've all seen that are kind of problems when you're measuring, or pitfalls when you're measuring implementation outcomes. Skipping over key outcomes that make sense for the questions that you're asking. Using homegrown measures. I think there are enough measures out there in the literature that you don't need to do that anymore. Failure to directly measure your implementation outcomes. So sometimes people will say, we're going to look at fidelity, but then they don't have a real measure of it, and that's a no-no. And then if your unit of analysis is inconsistent, so you're measuring penetration, you're implementing at one level, you're measuring penetration at another level, and so on. So there's lots of resources for instruments and measurements that are on these slides, and we'll post these so you'll have access to these URLs. So then just some additional tidbits is making sure that you're really justifying your choice of implementation outcome, why that is the right outcome to look at. Always good to map from your theory models framework all the way to your outcomes and to your measures of those. And really reflecting on your implementation outcomes in your study goals and aims, I think, is really quite important. And then measure robustly. So now we can go to Slido in our last 3 minutes. So I'm sorry, Becca, I didn't
No.
mean to go too long there, but.
No problem at all. People were very active in live participation, which is really what we wanted more than anything else. Slido was our crutch. And I'll say that the top question that I was going to put out, you've already answered, but I wasn't sure if there's more that we want to say is around, are there standard tools for measuring implementation outcomes like surveys? We've talked about some qualitative data, but just kind of getting to that measurement piece, if we want to dig into that a little bit more, I think that would be the top one.
Yeah, I'd love to hear what others think as well, but I think that measuring these things objectively to the extent that one can is important. I think having, strong psychometric measures is important. We risk as a field, I think sometimes being a little too soft, and the field is getting more popular. People are jumping into it thinking, oh, this is so easy, and it's really not easy. We know that. But if we measure it lightly, then I think we do ourselves a disservice as a field. So I think I'm really trying to measure these things robustly. But I think it was Hannah that raised the point earlier. Multiple measures is always better, right? So you're always going to understand more if you have a quantitative measure, but also a qualitative measure. And so especially on this implementation outcomes, trying to understand what's behind them, the quantitative measures, I think, is really important. Sometimes you're doing pilot work and you don't have enough implementers even or stakeholders to be able to have the quantitative measures have value. So then sometimes you just have to do qualitative only, but I think quantitative is quite important. Others have thoughts on that? Any disagreements on that?
I was going to say that what we often don't think about is what's feasible for our partners in the community and how to collect these things. And sometimes we have very ambitious ideas about measuring context, measuring outcomes, measuring mediators, and all sorts of things. And the communities are just trying to work as good partners and getting the basics. And so I think there's also a lot to be said, even though I agree that multiple measures can be helpful. Parsimony and things that are practical, pragmatic, and easy to do and understand also, in my mind, go a long way.
Yeah, I agree. Yeah, I think the response burden is really a big issue for many of our partners. Well, we're at time, Becca. I don't know if you want to take one last question or you want to just call it.
No, I think we can call it. I
Okay.
think we're great. Yeah. Thank you so much, everyone.
Thank you.
As a reminder, if you do want to do the works in progress, please do email us. I think that was the number one thing. And thank you for your great participation today.
Yeah, thanks so much, everybody. This was a lot of fun to do. So much more fun having people on camera and people engaging than just giving a talk to a lot of blank screens. So thank you for that. Bye, everybody.